Hello, my name is Brian Houston, and I'm a Doctor of Nursing practice student studying at Southern Adventist University. This is Module 2, COVID-19 Recognition and Plan Implementation. This module does build upon Module 1, which was Fundamentals Prior to Infection. If you haven't watched that video, I highly encourage you to go back and do so, as it does introduce some concepts that, again, this will build upon. You may be sitting there asking yourself, why am I taking the time to watch this video? Why is this important? Why is this project important? The reason for this project in the first place is because I received a phone call that both myself and my wife were positive with COVID-19. She was 27 weeks pregnant at the time. I was in school. I was working. She was working. I didn't have a good enough plan. I had done some research. I had read several studies. I knew a little bit about what was out there in regards to COVID-19, but I didn't have a plan for when that positive test smacked me in the face. So I drove home. I immediately got on my computer and I researched as much as I could until I had to go to sleep that night. And then during the 14-day quarantine, I essentially researched COVID nonstop. The goal for that was to find as much evidence as I could for both myself, but mostly for my wife and my unborn child at the time. I wanted to see what the evidence was out there, what were things that I could do to help them. And pregnancy, and we're still learning, it's kind of an unknown. Pregnancy is actually an increased risk factor for severe disease with COVID-19. And I wanted to do everything in my power to prevent something happening from both my wife and my child. That's why this project is important, because I don't want you guys to be smacked in the face and not have a plan. I want to bring everything that I can, everything from my work experience, from the research that I have done, to you guys to help you guys be ahead of where I was and to prevent people from getting hurt and injured from this disease. How do I know if I have COVID-19? Well, COVID-19 presents in broad-ranging viral symptoms such as cough, fever, body aches, headache, sore throat, shortness of breath, diarrhea, nausea, vomiting, and loss of taste or smell. Right now, we are seeing more sore throats and less of a loss of taste or smell with the Omicron variant, but we are still gathering data and learning how that differs from the previous variants. Symptoms may appear 2 to 14 days after exposure, or maybe not at all, and severity is broad-ranging and hard to predict. With the rapid antigen versus PCR testing, the rapid antigen tests have a quicker turnaround time. Usually you'll get your results within an hour or two, while the PCR testing does take longer. Typically it's a 24-hour turnaround. It is more sensitive and more specific to detect COVID. So you or a family member have tested positive for COVID-19. How do you put your plan into action? Well, first of all, talking about your pulse oximeter, when you go to get a reading, it's important that you put the pulse oximeter on your index or your middle finger. The reason for that is you have a large blood vessel, the radial artery, that supplies oxygenated blood to that side of your hand, and you'll get a more accurate reading that way. You also want to ensure that your hands are warm and that you leave the pulse oximeter on your fingers for 1 to 2 minutes. This is to allow your fingers to warm up for it to get an accurate reading, and go with the reading after it's been on for a couple of minutes. It would also be a good idea to get up and walk around and compare your oxygen saturation readings to both sitting and standing and walking to make sure that it's not dropping when you get up and walk. With your temperature, it's important that no food or fluids be consumed within 10 minutes of obtaining an oral temperature. That's because it can change the reading and lead to an inaccurate reading. You may miss that you're actually running a fever and think that you're not. A low-grade fever less than 100.4 may actually be beneficial to your immune response. However, a consistently high fever greater than 101 may have a negative impact on your body's immune response and your hydration status. This may be controlled with Tylenol and ibuprofen. Just read the labels and don't exceed the dosages that are recommended. It's critically important that you ensure adequate intake of food and fluids, as running a fever increases the risk for dehydration. Vital signs such as temperature, heart rate, oxygen saturation, and blood pressure should be taken 3 times daily. I like to think of taking them with breakfast, lunch, and dinner, or with any concerning symptom. You need to ensure that your COVID battle buddy is available and willing to assist you. You also need to implement quarantine planning by isolating individual family members to avoid reinoculation and ensure adequate ventilation by opening windows as weather allows. The reason that you want to quarantine individual family members, for an example, a husband and a wife, may actually ideally need to sleep in separate rooms, because as you exhale, you're actually shedding the virus, and the other person or even yourself can breathe in that virus and continue to re-inoculate yourself with the virus. This could increase viral loads. By separating, opening up windows, allowing the house to ventilate, or using a HEPA filtration with UVC, this can decrease the virus that's actually floating around your home. You also ideally want to go outside. Spend as much time outdoors as possible, depending on weather conditions. Obviously, if it's extreme heat or extreme cold, then you wouldn't want to do that or very much limit your exposure. Ideally, you would be out in the sun for 15 to 30 minutes daily. This will up your levels of vitamin D. However, do not overexert or stay for prolonged periods in the heat, which may lead to increased dehydration and increased severity of disease. Extreme heat or cold should be avoided. 15 to 10 minute walking sessions intermittently are also beneficial. It's important to avoid overexertion in that case, though. It's also important to monitor your calves for any sign of redness, swelling, or warmth. This may indicate a blood clot, and any signs like this warrant an immediate medical evaluation. COVID-19 is a very strange virus. It's one that produces blood clots in a manner that I have personally never seen in my practice, and I don't think really anyone in the medical community has seen it in the way that COVID-19 promotes blood clotting. And we'll go over that a little bit more in the next module. But checking both your legs and specifically your calves for redness, warmth, or swelling may help you to detect a blood clot and be able to get treatment for that before it gets out of control and causes further problems. You also want to avoid sugar and dairy, as both of these depress the immune system, promote inflammation, and increase mucus production. Eat as many dark green leafy vegetables as you can stand. Other vegetables aside from dark green should be bountiful in a variety of colors, as the color content can help to differentiate a variety of beneficial polyphenols. These are things found in plants which have a variety of health benefits, including antiviral activity, and we'll discuss that in the next module. You also want to attain adequate sleep, with at least 8 hours being optimal. You also want to ensure adequate hydration by drinking at least your body weight in pounds divided by 2 of water per day. So for example, a 200-pound person, you would divide that by 2, that's 100 ounces of water per day. That's at least as a minimum. If you're running a consistently high fever, you're breathing faster, you're not drinking as much, those would be reasons to increase your intake to make up for those things. If possible, you also need to obtain an incentive spirometer and use this every hour with 10 strong inhalations through the mouth, holding your breath for at least 3 to 5 seconds with each inhalation and documenting the maximum inspiratory volume achieved. If you're unable to obtain an incentive spirometer, and oftentimes patients get those after they've had a surgery or from the hospital, you can use 4-7-9 technique by breathing in through the nose slowly for 4 seconds, holding your breath for 7 seconds, and then breathing out slowly through pursed lips for 9 seconds. 10 cycles of 4-7-9 breathing should be completed every hour, just like you would use an incentive spirometer. The goal of these exercises is to open and expand your airways, which will also mobilize secretions and help to protect against pneumonia. One of the most important things that I want to talk to you guys about is positioning. This is something that's not talked about nearly enough. The worst thing that you can do when you are sick, and especially when you are sick with a respiratory disease, whether that be pneumonia or before, or a severe pneumonia especially, is laying flat on your back. Flat on your back allows all those organs to basically compress the area where your lungs expand and make it harder to breathe. By at least sitting up, this allows gravity to pull those abdominal organs down. It allows your diaphragm to more freely expand, to open up, and to allow your lungs to fill with air, which allows gas exchange, allows a bunch of other processes. But particular in COVID-19 and another condition called ARDS, proning is something that also may be applicable. The practice of proning, or having patients prone or lay flat on their belly, has been used in the treatment of acute respiratory distress syndrome, or otherwise known as ARDS, for several decades, and is considered a standard of care. The most common diagnosis for admission into the hospital with COVID-19 is pneumonia. Severe pneumonia may result in acute hypoxic failure, which can develop into ARDS. And multiple peer-reviewed studies have actually demonstrated the importance of proning in COVID-19, and the earlier the proning is introduced, the more beneficial the outcome will be, with studies showing proning may prevent patients from developing respiratory failure. As you can see from the diagram on the left, proning allows the lungs to more fully expand by decreasing the compressive effects of organs such as the liver would normally exert on the posterior lung fields. Your lungs essentially kind of sit slanted in your body, with the top portion of your lungs sitting towards this area of your chest, and the posterior, the dorsum lungs, kind of sliding through to your back, kind of sit behind those organs. So when you lay on your back, it allows those organs to compress the back of your lungs. And by allowing your lungs to more fully expand, like with proning, taking the pressure off the back or posterior lung fields, this allows for increased recruitment of alveoli, increasing the alveoli participating in gas exchange, in turn decreases VQ mismatch, which improves oxygenation and decreases hypoxia. Hypoxia is simply where you don't have enough, you have blood that's flowing appropriately throughout your body, but it's lacking oxygen content. So allowing more gas exchange allows your lungs to offload CO2 to onload O2 and to be able to take that throughout the rest of your body to the tissues. It's important to note that proning may cause anxiety and may be difficult to tolerate for long periods of time. A good regimen for positioning is illustrated in the diagram to the right and consists of position changes every 30 minutes to 2 hours as tolerated. Position changes decrease the amount of time gravitational pressure is applied to a specific lung zone. Patients should not prone if they have an unstable spine, thoracic injury, or recent abdominal surgery. Patients should be cautious in pregnancy, morbid obesity, facial injuries, or in the presence of neurological conditions such as a seizure disorder. I would recommend in those conditions to at least rotate side to side, and then if you are going to be on your back, at least sit up. Don't lay flat on your back. A link to the Bentley et al. Study featuring guidance and patient instructions for proning and repositioning is provided just below the link for this video on the Wix website. This journal article features both positioning instructions, which are a free download, and also a handy vital sign sheet, which is also free to download and print. I highly encourage you to look at those, as they may be very beneficial and helpful for you to keep track, especially when you're sick. If you were to have COVID-19, it can get very confusing, both due to the stress of having COVID-19 and actually the effect of COVID-19 on your body. So the more things that you can have written down, the more beneficial it will be. Next, when do I seek a higher level of care? When do you call your doctor? If you have a consistent pulse oximeter reading of less than 95%, and it's important before you get COVID-19 or at the very beginning of the disease to establish what your baseline is. If your baseline is running 99% and you're dropping below 95%, that absolutely warrants a need for you to call your doctor. If your levels normally run lower than that, if you have a pulmonary disease such as COPD, your baseline oxygen levels may actually be somewhere closer to 92 or 93. They may normally run lower than 95% due to the damage of COPD on your lungs. In that case, it's important to establish a baseline beforehand. You can ask your doctor what your baseline is at your doctor's visit, or you can establish it on your own with your pulse ox. And if that deviates the same, 4 to 5% less, then absolutely contact your healthcare provider. A significant or worrisome cough with accompanying shortness of breath, you should contact your healthcare provider. They may want to put you on some steroids or implement other treatments such as breathing treatments. So in that case, it would absolutely warrant, if you have a progressive cough, you're worried about a pneumonia, to at least call your doctor. If you're unable to hold down food or fluids, and especially fluids, the reason for this is if you're at the point where either you don't have an appetite and you just can't do it, or you're sick to your stomach and you throw up, it's very easy and you can get behind very fast on your hydration status and become dehydrated. And that leads to a whole cascade of problems that can severely increase your risk of severe disease. So that's absolutely a reason you'd want to contact a doctor. Redness, warmth, or swelling the calves. We talked about this earlier. That is due to the risk for a blood clot, and especially the increased risk with infection in COVID-19. When do I call 911? If you have a sudden mental status change, and this is where your battle buddy really comes into play, or a family member that's been at home with you. If you have someone that's been consistently laying eyes on you and you had been acting normal, and then all of a sudden you have a quick change, you're confused, you're tired, you won't wake up, especially in that case where you're unable to wake up, you're very sleepy, hard to arouse, and you had been functioning close to normal before then, that would absolutely warrant a call to 911. If you have any weakness on one side of your body, like all of a sudden you can't use your left arm or your left leg or facial droop, that would be also reasons to call 911. If you have increased work of breathing, so difficulty speaking, increased shortness of breath, rapid respiratory rate, or audible wheezing, those may be reasons to call 911 as well. When you have an increased work of breathing and you're having trouble getting out your words, you're becoming increasing short of breath, you may have a little bit of shortness of breath with COVID, and that could be something as simple as due to congestion, or it could be due to a developing pneumonia. But if it's a suddenly increased shortness of breath, if you are so short of breath you can't get air in and out and you are having trouble forming your words, those are absolutely reasons. Don't call your doctor, call 911 in that case. And sudden chest pain not related to cough. With COVID-19, you may have pain that started after you began to cough, and that's because you have different muscles throughout your chest, and those can be inflamed, and those can become irritated, and it can be painful when you cough. So if you're tender to touch on your chest, if it only hurts when you cough, that may be a reason to call your doctor, but not necessarily 911. However, if you were to have a different type of chest pain, all of a sudden it did hurt when you cough, and then now it hurts all the time. It feels like someone's sitting on your chest. Those are textbook symptoms for problems with your heart, and that would absolutely warrant a call to 911. If you have bluish discoloration to your lips or face, or a dusky discoloration depending on your ethnicity, those are absolutely a reason to call 911, and that should correlate with decreased pulse oximeter readings on your portable pulse ox that you're taking at home. But the blue discoloration can indicate significant hypoxia and absolutely warrants a call to 911. If you have syncope, you're fainting or you're passing out, like we talked about with a sudden mental status change, it's a little bit different. But if you are passing out, you're faint, you have an episode where you fall and collapse, you wake up and you're confused, that would absolutely be a reason to call 911, or hopefully have your family or COVID battle buddy call 911. You may have some confusion just with this gets confusing, and I want to clarify it just to make sure you guys understand. With COVID-19, there may be a brain fog, which may be you're a little bit slower than usual. You're not as sharp as you typically are. That is different than a sudden mental status change, or if you have fainting or passing out. So a little bit of, I feel a little bit out of it, is normal for the progression of COVID-19. Sudden mental status change, you're passing out, you're sleepy, you can't answer questions appropriately. The person who has been checking on you, your battle buddy or your family, notices a big change. That's absolutely a reason to call 911. That's the end of Module 2. Please come back for Module 3, and we're going to discuss both early treatment and prevention, supplements and medications to discuss with your physician.